Welcome back to Wally's nursing videos. Today, we'll be exploring the vital functions of the liver and what happens when these functions are altered. Liver dysfunction can lead to a variety of clinical manifestations, and understanding this can help you provide better care for your patients. By the end of this video, you'll be able to describe the key functions of the liver, recognize the clinical manifestations when liver function is impaired, link pathophysiology to symptoms, which will help guide your nursing interventions, functions of the liver and their altered manifestations. The liver is involved in several essential functions, including bile production, hormone metabolism, drug metabolism, carbohydrate and fat metabolism, protein synthesis, and storage of vitamins and minerals. Let's go through these functions one by one and discuss what happens when they're impaired. Production of bile salts. The liver produces bile salts, which are crucial for the digestion and absorption of fats and fat-soluble vitamins, A, D, E, K. When this function is impaired, patients experience malabsorption of fats and fat-soluble vitamins, leading to symptoms like steatorrhea, fatty stools, vitamin deficiencies, and poor wound healing. Key learning point 1. Without proper bile production, patients can't absorb fats or fat-soluble vitamins, leading to malnutrition and other complications. Elimination of bilirubin. The liver helps break down hemoglobin from old red blood cells and excretes bilirubin through bile. When this function is impaired, bilirubin accumulates in the bloodstream, causing elevated serum bilirubin levels and jaundice, which presents as yellowing of the skin and eyes. Key learning point 2. Liver dysfunction can cause bilirubin buildup, leading to jaundice, a hallmark sign of liver disease. Metabolism of steroid hormones, sex hormones. The liver metabolizes sex hormones like estrogen and testosterone. When this function is impaired, patients may experience disturbances in gonadal function, including gynecomastia, enlarged breast tissue, in males due to an imbalance in estrogen levels, glucocorticoids and aldosterone. The liver also helps metabolize glucocorticoids like cortisol and the mineralocorticoid aldosterone. When impaired, you may see signs of increased cortisol levels resembling Cushing's syndrome, with symptoms like weight gain, moon face, and high blood pressure. Hyperaldosteronism may also develop, leading to sodium retention and hypokalemia, low potassium levels. Key learning point 3. Altered hormone metabolism in the liver can lead to hormonal imbalances, contributing to gynecomastia, Cushing's syndrome, and electrolyte disturbances. Metabolism of drugs. The liver plays a key role in metabolizing drugs, ensuring they are detoxified and eliminated from the body. It also produces albumin, which helps transport drugs in the bloodstream. When this function is impaired, drug metabolism is reduced, leading to increased drug levels in the body and potential toxicity. In addition, a decrease in albumin production means less drug binding, further increasing drug availability and risk for toxicity. Key learning point 4. Impaired drug metabolism in liver dysfunction can lead to drug toxicity and requires careful monitoring of medication dosages. Carbohydrate metabolism. The liver stores glycogen and helps maintain blood sugar levels by converting glycogen to glucose, glycogenolysis, and synthesizing glucose from other substrates, gluconeogenesis. When impaired, patients may experience hypoglycemia due to decreased glucose production and storage. An abnormal glucose tolerance curve may develop, indicating impaired glucose regulation. Key learning point 5. Impaired liver function can disrupt blood sugar regulation, leading to episodes of hypoglycemia. Fat metabolism. The liver is responsible for forming lipoproteins, converting carbohydrates and proteins into fat, and synthesizing and eliminating cholesterol. When impaired, you may see altered cholesterol levels and impaired lipoprotein synthesis, affecting cholesterol and fat metabolism. This can lead to fatty liver and further complications. Key learning point 6. Liver dysfunction impacts fat and cholesterol metabolism, contributing to systemic metabolic disturbances. Protein metabolism. The liver deaminates proteins, converting ammonia into urea for excretion, and synthesizes plasma proteins and clotting factors. When impaired, you'll see elevated blood ammonia levels, which can lead to hepatic encephalopathy, confusion, lethargy, and coma. Decreased plasma protein production, particularly albumin, can lead to edema as fluid leaks from the blood vessels into surrounding tissues. A reduction in clotting factor production increases the risk of bleeding, as the body can no longer effectively form clots. Key learning point 7. Liver dysfunction causes elevated ammonia levels, leading to encephalopathy, and decreased production of clotting factors, increasing the risk of bleeding. Storage of vitamins and minerals. The liver stores essential vitamins, including fat-soluble vitamins A, D, E, and K, and minerals such as iron and copper. When impaired, patients may present with signs of vitamin deficiency, such as poor vision, vitamin A deficiency, easy bruising or bleeding, vitamin K deficiency, and bone issues, vitamin D deficiency. Key learning point 8. When the liver cannot store vitamins and minerals, patients are at risk for deficiencies that affect various body systems. Filtration of blood and removal of bacteria. The liver contains specialized cells called Kupffer cells that filter out bacteria and particulate matter from the blood. When this function is impaired, patients may be more susceptible to infections due to increased exposure to bacteria, particularly from the gut. Key learning point 9. Liver dysfunction impairs the body's ability to filter out bacteria, increasing the risk of infections. Conclusions. So, there you have it. A detailed breakdown of the liver's functions and what happens when those functions are altered. Understanding these manifestations can help you as a nurse recognize early signs of liver dysfunction and intervene appropriately. Thank you for watching Wally's nursing videos. If you found this video helpful, be sure to like, subscribe, and hit the notification bell so you never miss out on more educational content. See you next time.